So without wasting so much time, I think we already have the agenda put up by Ade, admin Amaka. So I'll go ahead now to introduce our speaker for today. And I'm sure most of us who have done the DIPC program would have come across him from the very, very esteemed FMC epitomator. Because that's usually where we go for site visits during the program in Lagos. So our speaker for today is Dr. Abdulrazak Olagoke Usman, who has been part of the success story of transforming the Federal Medical Center Ebotemeta to a model healthcare facility in the country. As the head of quality improvement and infection control at the institution, he and his team propelled the hospital to attain a 4-star rating in 2021 by the Safe Care organization, which is accredited by the International Society for Quality in Healthcare External Evaluation Association. Dr. Usman is a graduate of the University of Ilorin and a fellow of the West African College of Physicians, Faculty of Family Medicine. He also has bagged a diploma in infection prevention and control from the College of Medicine, University of Lagos, and is a very senior consultant at his institution. And he's also involved in the training of resident doctors at the facility. He is currently the IPC focal person and the head of department for Department of Quality Improvement and Infection Control. So you can see we have no other person who is best suited to give us take us through this session as Dr. Usman Olagoke. So yeah, welcome.
Thank you, Dr. John Ejembi. Thank you for the introduction. Yeah.
You're welcome, sir.
The admin and all the participants on this call. And I thanks to people that as we go further. Yes, my name is Dr. Olagoke Usman, and I'm happy to be here to learn and unlearn with you all. Yeah, so I would like to share my slide. Am I in the permission?
Yes,
Yes, go ahead, sir.
sir. Yeah, yeah. So you can.
Okay, can my slide be seen now?
It looks blank, but it's telling me that we are viewing your screen. Although it looks okay, yeah, we can see your screen now. So maybe just put it in presentation mode.
Okay. So how is it now?
It's perfect.
It's better now at my end. I can see it. Welcome all. Good.
All right. Yes.
No, I was just greeting. I say good. I was just
Someone
greeting. Say greeting to everyone.
I can go ahead. You can.
Sorry, Doctor. From your end, your voice is speaking.
Maybe it's from clear. It's a
Good.
network.
Okay. Okay. So, saying industry management in healthcare facilities and ensure efficient. Uh, I want to start. There's a set of activities that you use to prevent the transmission of organisms or infection in both recognized and unrecognized patients with infections. What that means is that every patient that we deal with, we assume that they are carrying pathogens that will later become an infectious disease when we contact it. So in order to prevent this, we use precautions, which are called standard precautions. When you know the ailment or the disease, that is when you now use transmission-based precaution. So one of the activities of our standard precautions, like you all know, is how we handle linen correctly, such that the patients, the staff, healthcare workers, the laundry staff, and everybody remains safe and free of organisms that can be transmitted through handling of linen. So let's understand what we mean by linen. We know that in the hospital, especially on the wards, we make use of a lot of materials like bed sheets, pillowcases, and blankets. Most of them are fabrics, but you agree with me that we also have some rubber and plastic materials that we use, like our Macintosh, and where you don't use a disposable apron, you use a reusable Macintosh that is water resistant. All of these, including theater items like the sterile packs, all the things that we use in the theater, the gown and everything, all these constitute linen. So as we go further, when we talk about linen, these are the things that we are actually talking about. And then we need to define some things. General linen, these ones are the ones that have gone through proper laundry so as to remove organisms that might be there and be safe for staff and patient use. The theater laundry, you find them in the theater. These ones, we use them in sterile fields. And so they have to be sterilized in the CSSD after they have been laundered. In which case, you take the linen to the laundry for laundry processes, after which you take it to the CSSD for it to be sterilized. That's for people who don't use disposable things in the operating theater. So the reusable ones, you have to sterilize it. Those are clean linens. Now the dirty linen, we classify them as used, soiled, infectious, or infested. Use is that you have used the linen, you have spread the bed sheets on the bed, the patients have slept on the bed, and then you want to change the bed sheets. It is already used. Soiled is used linen that is visibly soiled with blood or other fluids or even fecal matter, most especially. And an infectious linen is the linen that an infectious disease patients have come into contact with. Like if you have a cholera ward and the patients with cholera are sleeping on your bed or are using other linen, those ones are highly infectious linen, whether they are soiled or not, because it's not all infectious linen that will give you something like cholera where you now have feces contaminating your linen. It may be things like tuberculosis or even organisms that you know that are multi-drug resistant. because you don't want to spread a multi-drug resistant organism to other patients or people on the ward. So we take care of infectious linen separately. I mean, especially if they are the ones with parasites like scabies, lice, fleas, and bedbugs. So why are we so interested in dirty linens? You may not see it, but once you sleep on your bed, the bedsheet already have your skin flakes. You know, every now and then we shed our skin. So these skin flakes and hair follicles, they are loaded with a lot of organisms. So that is where the transmission starts from. And if perchance the linen is contaminated with fecal material, this one has the highest risk of transmitted disease because anything wet, we prevent the organism from dying due to dehydration. So we talked about infectious linen the other time. These are examples of infectious and use linen in taking care of the careful. So the list is inexhaustible. Like you see, I did not even put cholera here, which is what is going on right now in some places. So you have typhoid, you have dysentery, you have hepatitis, tuberculosis, HIV, and so on. Now, linen management is important because, like we said in our introduction, it's part of the standard precautions that we have to take to control infection. And you agree with me that if you lay and rags, you won't feel like lying on it. So in terms of comfort and dignity, we need to manage our linen properly. And then it supports your hospital reputation and ensures safety standards. The objectives of managing linen are to provide clean and adequate linen supply, prevent cross-contamination, maintain smooth hospital operations, and the likes. In healthcare facility, you can see linen as a cycle of collecting dirty linen, so sorting and segregating it, washing and disinfecting it, drying and ironing it, taking it back for storage, and then redistribution to where they came from so that it can be used again. So, and the cycle goes on and on and on like that. So, while collecting dirty linen, you should avoid aerosol formation. What that means is that you do not shake especially bed sheets, you do not shake it. You remember what we talked about dirty linen, what they contain. This linen contains flakes that can easily be dislodged and aerosolized and can lead to transmission of infection if there are pathogens in those flakes. So what you do is just roll, fold towards the center. Don't just grab it and remove here. No, gently do it. The under part, you roll it over to cover the outer part to make a ball and then place it directly in a linen bag at the bedside. Wet linen, you put them in linen-proof bag and keep closed. And then you store it, especially in our sluice room, which should be closed at all times, with the bags also full. Just like boxes for important food, so that you don't overfit. If you are using the canvas linen bags, you must wash them regularly and immediately if you notice that they are soiled. But some of us don't use this. Maybe you are using a bigger plastic container. Some is used for dustbin, but this one is specifically designed to contain dirty linen and must be clearly labeled. Then you transport the linen. You transport the linen in all of these it depends on what you have. One thing, label it as dirty linen, must have cover. If it is the soluble bag that is used for taking infected linen, you cover it. As soon as you put your infected linen in it, you tie it and place in a container for soiled linen. Now, the rubber and plastic linen are the thermolabile linen. Those ones, as well as the other used linen that are dirty, you can put them in logs, and bags is leaking, you can even polythene sheets. So what do? We take these things to laundry. Something is looking, especially sharps and other items like lost but found items. You know, some people, their earrings, wedding rings, their necklaces, or even material and all those things may be inside the linen. They have to be removed. That's sorting. And I said especially sharps. So in this way, we need to teach our laundry staff, all IPC professionals. Their professional training is one thing on one side. Now, the IPC professionals should also teach them to be very cautious when they are sorting laundry and to expect sharps in the laundry. When they find sharps, they should report to their supervisor so that it can be escalated. Records of sharp objects must be kept, and incidents of exposure, probably in the process of handling the linen, one gets pricked by a sharp material. All those incidents of exposure must be reported. I believe every hospital has injury protocols, and when a laundry person is pricked with a sharp, like needle or suture or knife or whatever, broken bottles, that incident must be reported, and the needle injury protocol should be initiated for that person. So you also segregate into what kind of fabrics are they, colors, from which word, like that, so that you have to deal with them separately to do as soon as you get those things to the laundry. And when you are doing the sorting and segregation, make sure that you have minimal handling of those. Like we said, don't agitate, don't shake, don't aerosolize, use your PP appropriately, and never forget hand hygiene before and after changing or removing your gloves. And consider all items such as surgeries from theaters as contaminated and potentially infectious. Even if there is no visible contamination, you cannot see blood stain, you cannot see urine stain, whatever. Just consider them highly infectious, especially when they are coming from the theater. So you never place linen on the floor or any clean surfaces. All right? And you don't do sorting by the bedside or rinsing by the bedside or care areas. So in the laundry, what we do in the laundry is to decontaminate the linen. Apart from making it clean, you also decontaminate. That is the primary purpose of taking it to the laundry. And your laundry must be unidirectional with clear separation of clean area from dirty area. In the dirty area, you do the sorting, you load the washers, while the clean area, after washing, you unload the washers, you dry, and you iron. This is a cycle to represent that. And these are the things you find in dirty areas in brown, the things you find in clean areas in blue color. Laundry must have a separate clean and dirty areas for laundry. We said that there must be access control. Not just everybody can enter, and you cannot be coming from dirty area and enter the clean area. There must be access control. Like I said, it is unidirectional for the linen from dirty. The movement is not about laundry staff. It is about the linen that is unidirectional. Now, staff and equipment should not move from one area to the other. The contamination process must be validated and reliable. So these are summary of the laundry process and standard. Is okay to use industrial washing machines, but where that is not available, we need to do extra precaution in hand washing, which is not advisable. But if that is the only thing that you need to do, you must make sure that your PPE are appropriate for that. When you are doing the washing, the water must be at the right temperature and you must use the right detergent for your washing, including your disinfectants. You follow the disinfection protocol of your center or of the manufacturer of the machines that you are using. And you must do quality checks for cleanliness and damage. So that means after washing, before you wash, you do sorting and segregation. Even after washing, you still have to do sorting and segregation. This time around, the sorting will now be to check which of these clothes are clean, are properly clean or not, which ones are stained, which ones have been damaged that needs to go to the tailor or that needs to leave the system entirely. That. These are just a summary. So these are the things we've talked about: exception, the storage. This storage should not be for more than 12 to 24 hours. In some institutions, they don't store in the laundry. Like in my center, the laundryman goes around the world in a day, exactly 8 a.m. He leaves the laundry and goes around the world and pack all the dirty linens that are in the sluice room, take them to the laundry, they return it in the evening, the same process the following day and all. So it doesn't, you don't store your dirty when in the sluice room more than 24 hours. And your laundry must be cool because since we are working with a lot of machines that generate heat, you don't want to discomfort your staff. They don't have to be sweating and then contaminating your linen as well. All right. So these are the washers. Like I said, you use an approved detergent and bleach in the correct concentration. And the temperature, you can set it on your washers. This is why you need a washing machine, and it is not a domestic washing machine that you and I have in our houses. Even some of them stated that will even give you, that will generate heat while you are washing. But this time around, you need to set, depending on what you are disinfecting, the heat to 65 degrees if you for 3 minutes. Some of our linen cannot take much of those heats. So the least you can do is 40 degrees for such linen so that you don't damage it. So that's what we have just said. The contamination is achieved by heat, by detergents, by additional chemicals like your disinfectants. And then you must take note of your exposure time when you are disinfecting. We have said this is a washing process. For plastic and rubber linen that you cannot put in your washing machine, otherwise you remove them tattered or even clogged because of heat. You only disinfect with hypochlorite solution. as the second to the last. All right. So probably you have wiped with soap and rinse, then you dip inside the hypochlorite solution for some minutes, 10 to 15 minutes, before you now rinse it and hang. Laundry economics, you need to use as little as possible. Water is expensive, though it's everywhere, but it's expensive. If you don't have your own borehole and you are buying water from the public and you don't have public water supply in your hospital, you realize that water is very expensive, even though it is everywhere. So you use little water as much as possible, because the more the more you still mils of and just have a tablespoon of soap. You agree with me that if you use that same handkerchief and you want to wash 1 bucket of water, the soap you use will be more than the half teaspoon. So you use more chemicals, you use more disinfectants, and you use more energy to heat it up. If you are using washing machine, for instance, that cannot regulate the amount of water, for it to heat it up to that 80 degrees centigrade that you want to use, or 75 degrees, and electricity. For people who are not in Nigeria on this call, we have different bands of electricity with different rates. Band A being the most expensive. You need to hit it up. So this is another essence of using a very big or industrial washing machine, because the more rapid the wash process, the more linen they will be able to wash in it. So rather than using your smaller washing machine and then you have like 1,000 bed sheets to wash, how much time that consume? So that is part of the economics that we must take into consideration. Now, the clean laundry area, what do we have there? You unload the washers, you do the finishing, that's the sin and segregation. Then you dry, you iron, you fold, and you store. That's just the summary. So how do you dry? You tumble dry. Usually there is a separate machine that will dry your clothes, and then you iron them. If it's dryers, you can sun dry, but it's not as effective as using these dryers, because even these dryers will help to decontaminate by the heat they also produce. Apart from the heat of washing, they also produce heat when they are drying it. Sun dry, you rely on the to decontaminate or disinfect your material. And if you sun dry, don't rely on that sun dry. Try as much as possible to complete it with ironing so that you get a perfect decontamination of your linen. So to transport your clean linen, you need covered carts, different types of carts. You make do with whatever you have. Just be sure that they are clean, regularly disinfected, they are covered, so that by the time you are wheeling areas that has it, they will not gather dust, they will not gather other infectious organisms before they get to the area of use. And then you store linen in cupboards. You stack them neatly in cupboards. Mix used linen with clean linen on the ward. You need to let people on the ward know that if the nurses have assigned the health attendants to be doing that on their behalf, they need to be trained on admixture of clean and dirty linen. Once you remove this linen from the cupboard, please don't take it back. Whether you use it or not, you can else. It is considered as from this storage. So the properties of the cupboard must be clean. control measures. Safe handling of native linen. We talk about sorting that time. Those are infectious control measures. When you sort and you envisage or assume that you are like sharps, that's a good practice. You envisage it, prevent it from happening. Use of it for laundry staff, some investigation is a and you need to monitor and what you are linen that you are laundering to monitor it. It's monitoring this. Are they staying after wash? How many linen came? How many are torn? Stock. Why you carry of your linen. Another thing is infection connected, and you do, that is not the cupboard where staff will now put their food materials, their bags, or their shoes, or whatever. No, it's meant purposely for hospital linen. So the other aim is to prevent dirty linen from contaminating patients, staff, and environment, and also so these are to note, talking about infection, health attendants, and doctors. All healthcare workers should be trained, not just laundry staff alone, but emphasis is on laundry, linen management. Basically, the doctor forget sharps bed, and most we adhere to 5. So, trained linen management. Clothing when performing duty, especially in the dirty area. Hand washing facilities must be available both in the dirty area as well as in the clean area. Not just hand washing facilities, even your hand drops, your sanitizer should be available. So we said minimum agitation of dirty linen to prevent aerosolization. Linen should be placed in strong and appropriate bags or in a container at the bedside. At the bedside when you are changing it, not that they are stored at the bedside. So let's take that very well. It is not that you put the container at the bedside and store it for 24 hours. No. You realize that if we have nurses on the call, they can bear me witness. If you have a ward of 20 beds and there are 15 patients on the ward, you don't change the linens at the same time because they don't come the same day. Probably you change every 3 days or every 4 days, and then you want to change for like 6 people that day. So you have an assistant as you are changing. Your assistant is putting on the clean ones, depending on the kind of patient you are changing the bed, whether it's an unconscious patient or a conscious patient that can sit out and then you do your job. While you are doing that, that is where you place those linen inside bags until you finish and then pack everything to your sluice room. Never place linen on chairs or on other surfaces. So this is not the time that you remove bedsheet and put on the patient's chair or put on the floor or put on the bedside locker. No, they have to go into the appropriate bags or container. Soil linen must be handled with care at all times. Never rinse soil linen at the point of generation or in sluice room. This one is debatable depending on the facility that you work in and the amount of resources that you have. Some facilities, they do most of the pre-wash for soil linen before they get to the laundry. Some, they just put in a special bag and the laundry comes. The reason they do that is because when you leave it till the laundryman comes, for one reason or another, even if the laundryman did not come, that means that thing is still there and your organisms are multiplying by the minutes in geometric proportion. And for stain, it becomes very difficult to remove. So that's the reason some do the pre-wash in the sluice room. So we should all assume linen are contaminated. Of course, that is why we have standard precautions. Soiled linen in bags or containers should not be transported manually to the laundry processing area. If available, carts or containers with lids should be used for this transport. You should avoid unnecessary handling of linen. These are some of the PPE that we use in linen and laundry care. You have the gloves, you have your boots, you have your cap, your face shield, mask. Your glove can be nitrile glove, it can be heavy duty glove. Most of the time you use heavy duty glove that is reusable. So these are the PPE that you use. And remember, appropriate use and proper donning and doffing. Okay. So we have some challenges in linen management, like high turnover. If you have a lot of dirty linen at the same time and then the laundry cannot cope with it, it becomes a challenge for dirty linen to be stored for more than 24 hours. Like we have the clamoring, and for the purpose of this presentation is the IPC part of linen management. It carries a risk of hospital-acquired infections, either from the patient to the laundry staff or to the nurses on the ward, to healthcare workers on the ward. There is a risk of hospital-acquired infections if linen are not properly managed. Then the resources, the cost of resources is also a challenge. Where if we all know that money is hard to come by, and that once you don't have enough manpower in your laundry, all these things that we have been talking about will not go on smoothly. Once you don't have money to buy an industrial machine, industrial ironing, then if you have to iron manually, that means if you have 1,000 linen, you have to iron manually. You agree with me that human error will not allow you to iron it properly to kill some of those leftover organisms. It should just be done and folded without even ironing. So all these things are because of cost constraints and the materials that you use. These are challenges in linen management. Staff training and compliance. It's one thing to train your staff, it's another thing for the staff to comply, especially in the laundry areas. If your staff like shortcuts to everything, it is when they see you adjust. But you just put a secret camera there, you have to train and retrain on there is a positive attitudinal change. This is one of the challenges that we face. Best practices are standard operating procedures. Your machines, you have standard operating procedures. Your constitution of disinfectants should be written and followed. Detergent, the amount of water that you use. How do you do your pre-wash in the laundry? All these things the guidelines of doing it should be pasted everywhere. And then there should be adequate stock levels and inventory control, both at the laundry as well as on the ward where they are used. You must keep appropriate inventory. When you are running low of linen on the ward, you quickly alert the authorities and stuff to get more. Because if you have 20 beds, probably they will give you like 30 or 40 bed sheets. So you don't bring out the whole 40. Since you know that linen are recycled maximum of 24 hours. So by the time you are getting torn linen, faded linen, those ones will leave the system and you are counting it. Once it reaches a critical level, you order for more. These are best practices, and you cannot know that unless you keep inventory of what you have and what is going out. Staff training and awareness are part of quality assurance in healthcare services. If you don't train your staff, not only the laundry staff, infections will spread through linen. The ones that you cannot train, probably like admin staff and people in the store, they need to know, because sometimes some of these people do sharp practices. They bring their linen from home and ask the laundryman to launder it for them and take back. Please avoid bringing your own personal linen to laundrymen. If they want to launder it, let them use another machine that is not used in the hospital for laundry. That awareness must be given to all staff, because you carry a risk of getting some of these organisms that we are trying to prevent its transmission. The regular maintenance of laundry equipment. I want to use my center as an example. Everything we have it in double. 2 washing machines, 2 dryers, 2 ironing machines. So that when one packs up, before we get it repaired, we switch on to the other one. There's something is happening recently. The dryer packed up. They couldn't switch back to the second one because of wiring issue. To fix it, it has to go through contract, because it's an enormous amount that will be used to do it. Not to talk of even trying to repair the one that has spoiled. So what we resorted to do is go and bring our old dryer. Before we bought this industrial one, we have a small dryer that we're using. And that one too is a matter of time, because it's very small, smaller than the capacity of the linen that I had under. So back up if you don't do it. So regular maintenance is very good before the pack up. So if you don't check it, if you get your supplier to supply machine you and you don't enter into MOU on maintenance, these are the things that you will face. So it's best practice to enter an MOU for the supplier to maintain your machine for you, or to train your or engineers or people from works on what to do as part of, as not repairs. An expert in this washing machine has to do repairs. But now we are talking about maintenance. So even laundry staff short bits of maintenance, like washing it without linen to remove all debts that are clogging the drum some of the time. These are maintenance practices and they are best practices. So in summary, we have talked about hospital laundry and linen types. We classify the linen into clean and dirty and the various types, infectious type. And we also talk about proper processing of linen, what dirty linen means, what infectious linen, the kind of hazard they pose. Protect our, talk about As part of infection control with the aim of IPC in linen management, which is to prevent contamination of clean linen, patients, staff, and the environment at large. We talk about the use of PPE, we talk about minimizing contacts and treat all dirty linen as potentially infectious, and then handle linen carefully at bedside, avoid shaking, place directly into leak-proof bag. One thing we did not talk about is vaccination of healthcare workers, especially people in the laundry, against hepatitis B. It is highly recommended. So it's part of the IPC measures. And training and risk awareness are essential, especially when it comes to sharps and contaminated linen. In terms of laundry decontamination process, we talk about separate clean area from areas, maintaining a unidirectional flow for the linen, wash at specified temperature, use and chemicals to disinfect. We talk about laundry equipment and practices, and we also talk about transportation of linen and storage. This is for if you have the means, you can get the soluble bag. These soluble bags we are talking about are bags that you don't empty it. You just take it like that. As you pack the linen, it will dissolve it and release the linen to the machine and then start washing. If you can afford it, fine. It's one of the ways that you minimize contact with soiled linen. And then we also talk about using our carts that are covered and clean, and we maintain a separate storage areas for clean and dirty linen. The clean one in our cupboards, the dirty one in the sleeves room with proper access control. We also talk about laundry economics to minimize water, energy, and the chemical that we use. And we talk about washing cycles so that our machine can wash more and reduce the time. We also talk about regular maintenance of our machine and dryer. So if these are the talking for patient safety, you agree with me, and it requires cost effectiveness in our laundry management. Sorry, I prepared these slides in a rush. Some things may have been missed. I believe that during our question and answer, all of those things will come to light. Thank you very much for listening.
Thank you so much, Dr. Olagoke. I know that you've been under a lot of pressure in the last couple of weeks, so really appreciate that you could make time out for us to have this final session on this series. So please, can we share a reaction? I can really see so much. You brought in so much clarity, especially when it came to segregation of um linen and then the classification and definition of the various types of linen. So thank you so very much. So while I'm waiting to see whether we have questions, that while we still have this number, I will first ask if we can put on our camera so that the admin can take a picture before we start losing numbers. So please, everyone, can you put on your cameras? We have a momentum for the last session in this series.
Dr. Olagoke, please stop sharing your screen, please.
Okay.
Thank you.
Good to see you, Chief.
Where will I go to?
Is it dark?
Something like that.
No, but I can see you clearly from my end.
Okay.
Amy, are we good?
Have I stopped sharing?
I can still see his
Oh,
screen.
no, you're still sharing. Yeah, you're still sharing. So the same way, just click on where you have share screen. Just click there. You see stop share.
Problem is,
No,
Maybe you turn off your cameras so you can see well. Click share. You just click there. You see stop share. Then you pick the stop share option.
you want us to on our video so that you can see. So what is it for the facilitator?
Pardon? Okay, Ajunwa. No, we are trying to get him to stop sharing so that we can take a picture.
Oh, okay.
okay.
Amy, are we good now?
Okay.
Okay.
Well,
Can I take mine now?
that
Amy,
was a good well delivered lecture. Well,
Amy, are we good now?
Yes, yes.
you, the network is not so clear. The voice is
I think so. If we are okay, let us know when we
Okay.
can turn off so
Right.
that we can
Okay,
increase our bandwidth and we
okay,
can
please
continue our
turn off.
discussions.
Yes, let's just go ahead. Please turn off. Thank you.
That said, Nigeria's under 18 men have already begin their campaign at the IHF.
Please mute your mics. Thank you.
Okay. All right. Okay. So let me allow Ogochukwu.
But kind of on laundry economics. You know, it brought a practical perspective on cost control and resource optimization, and it stood out for me. Thank you so much, sir, for the presentation.
Thank you, Ogochukwu, for the
You're welcome.
comment. So, Dr. Olagoke, can I just bring in a few questions while I'm scouting through the charts for other clarification? So, first, when you talked about infested linen, how do we identify infested linen? Is it identified from the word, or is it something that is done in the laundry to determine where we have the possibility of infested linen? And do we bag that separately, or we do the same thing as the others? Then, secondly, a little bit of clarity when you talked about not pre-rinse of soiled linen in the sluice room. Is it an all or none rule, or there's indications
Sorry,
where we might have to rinse?
come again. You are breaking off.
Okay, is the network okay? My first question was when you talked about infested linen, is it something that is identified
I got that
from the
one.
word sluice room? that we must head to, or there are situations where we might have to rinse within the sluice room. I don't know if you understand my
Yes,
question.
I do. I do.
Okay. Then I think the third thing that I would like a little clarity on is the issue of the combination of detergent as well as bleach. Do we maintain what we are taught, where at least for routine clean?
Dr. Joan,
Differently? So
Dr.
thank you.
Joan,
Yes, sir. Yes, I can
please
hear you.
repeat the last question about detergent and bleach.
Okay, mixing detergents and bleach together in managing in handling linen. That was what I asked. Or do we do the wash cycle first before we do the disinfection cycle, or we combine detergent and bleach together? Just for clarity, sir.
All right. Can I go ahead?
Yes, sir. I'm looking. Yeah,
Okay.
thank you, sir.
Okay, let me start from the last question. No, I'm sorry if you perceive it that way, that I mentioned mixing detergent and bleach together. You don't mix them together. Okay. For soiled linen, part of the pre-wash that you do before going to the proper is to disinfect. When you pre-rinse, you disinfect and then put in washers. That's the cycle that we do here. They have a pre-wash area where you have soil linen that are stained with blood, feces, urine, and all those things. Once you rinse, you disinfect, you let it stay in your disinfector for a while before you take it for washing. And that is what we do. You don't add detergent and bleach together. It's just waste of time and resources. So the washing, once it is done, further disinfection will occur during washing with the heat, and then during ironing too with the heat. So that is what we do here. About rinsing in the sluice room, that's what I said, that it is not a rule. It is not an all or no rule, especially when you are in a ward that linen are soiled, like the theater, like
Please mute your mic.
hello. Am I still on?
Yes, go ahead.
But I stopped hearing you, so I was not sure whether it was my own network.
No, I also went off briefly.
Okay.
Okay, so I was talking about theaters, accident and emergencies where you have a lot of soil linen. Over there, you have the option of calling the laundryman immediately if you don't have a sluice room, or if you have a sluice room but you don't have the resources to pre-wash over there. When I talk about resources, you need a level table to walk. You don't have to be bending down all the time. You need your water, you need your bath, you need all those things. You need PE apparatus. So if you don't have that opportunity, you call the laundry people to come and take immediately. They don't have to wait for their routine 24-hour pickup and supply. So they can take it to their own laundry and do the pre-wash. But if you have all the means like we have in all our theaters, once they are through, all those blood-stained linen are pre-rinsed before they are packed to the laundry for laundry and then back to CSSD. So it is not an all or none rule. And that is why I said it is a controversial thing when they say that you don't pre-rinse in space room or healthcare area. Now, about infested linen, How do you identify it? Of course, during care, you will identify it. There are telltale signs of bed bugs. If you have a patient with scabies on the ward, any form of parasite like that. Apart from the periodic fumigation that the hospital does through the environmental health department to take care of all this infestation, once you identify such linen, you separate them, fumigate them before they are taken to the laundry for proper wash. And the heat as well as the drying, the ironing, we also do some work in killing the probably the eggs or even the mature adult of the parasite that have escaped the fumigation process. So it is identified from the ward, not in the laundry. So I don't know if I've been able to.
Yes, sir, you have provided additional clarity. So far, all the comments I saw in the chats were commendations on how wonderful the presentation were. Then there's a point of discussion here. Margaret Ayorinde has said she's thinking about the primary health centers, that they are the first contacts to health facilities, and when you visit them, there's no laundry unit. So, what are your thoughts on this, sir?
Yes, briefly, I mentioned it during my presentation that where you don't have some of these things, if they have to hand wash, that means they must be kitted. Their utility gloves, their apron, their face shield, their boots, and then the sorting is the same as they do in the laundry before they start the washing. The pre-rinsing is the same. The washing is the same. They don't have dryer, they sun dry. And if they can afford it and they have the personnel to do that, they also iron. There is a big challenge. You just need to make do with what you have, maximize whatever you have to the optimum. So in terms of getting cards and all those things, you can get, I mentioned something like, I even showed it that dustbins, cards that are meant as dustbin can be used. You just know that you repurpose it for carrying your linen, clean it properly, let it be covered. And in primary health care, you don't need much of transportation with those carts. Perhaps when you finish washing and drying and ironing, you just pack them neatly inside a safe cupboard. So the whole process is the same, except that the materials you use is a different thing entirely. Just improvise. Yeah.
Thank you so much, Dr. Olagoke. I'm sure at this point, all those of us that have been on the call will agree that he was the best person to have taken us through linen management, especially considering how simple and practical he made the presentation. So it's important for us to have our protocols in place and not to forget training, and then bringing in multimodal strategies when it comes to set up any program, any IC program. Well, before I continue, I can see Nurse Banke Olasigbe. Please, you have the floor. Good to see you.
Good to see you,
Thank you,
Ms.
Doctor.
Bange.
Thank you, Doctor. Good afternoon.
Good
Good
afternoon,
to hear
ma'am.
from you. It's been long.
Yes.
Yes.
Thank you for that beautiful presentation. I really acknowledge it and I enjoyed it. I'm curious about this issue of soluble linen bag.
Yes.
That's the first time I will hear about it. How can we get it purchased or get it used in our facilities? That's one. Then two, in some of our facilities, our patient relatives were being made to wash some of our hospital linen. So how do we cope that? Because most of them get infected. Nobody is giving them anything to protect themselves while washing. So either our nurses or those people that are working with stylishly will tell them, Madam, this linen has been stained by your patients, and we don't have facilities to do the washing. So please, you help us to wash before your patient is discharged, or even before you are given another linen. You must make sure that you clean this one. So in such cases, we see in most of our facilities that patients' relatives do the washing. So how do we cope that? Thank you.
Wow, this is another practical aspect of what happens. A lot of things happens in our hospitals due to lack of resources and sometimes, how will I say it, probably ignorance. All right. Patients' relatives are not to wash linen. They are not to wash linen. If any hospital is practicing that, it is not best practices. We are talking about quality of care as well as safety of our staff, our patients, and the patient's relatives as well. So it is not advisable, it is prohibited. In fact, it is criminal to ask patient relatives to be washing linen on the ward. And then as per the soluble bag, you may have to import it because it is not something that you can use regularly where you don't have the resources. It's one of the things that we use once in my center. Other things like there is a background or someone should move, please.
Dr. Juan.
Hello.
Dr. Juan,
So if you can hear me, some other things that we have. Yeah. So there are a lot of things that we try to practicalize and see whether it is feasible to continue or we just leave it at whatever we are doing before. I'll give you some examples. Before you enter our CSSD, there is a machine, and our ICU as well. There is a machine with plastic that you just place your leg in it. It traps your shoes with that leather before you walk in. It wasn't sustainable. So we went back to our shoe covers. We are experimenting on serviettes in few words. I can see telltale signs that it is not feasible, probably because of 2025 budget that was not released to any healthcare institution in Nigeria. Even the 30% that they said was released is to take care of some of those recurrent things. So they are not feasible. The same thing with this soluble bag. We had it once. Because the people that supplied the machines, the laundry machines to us, brought some. And what that does is you put your soiled linen in it and tie it. There are two types of those soluble bags. One is completely soluble. The other one is completely soluble, but they use soluble materials to join them together. What I mean, like probably you want to sew it and then soluble materials as your thread, such that when they enter the machine, those threads dissolve and then opens up everything that is inside the bag. Soluble bag, everything dissolves, and it's not going to, you will not see any remnants. It's like eating your, what is this popcorn that children eat? What is it? This yellow one. Is it lollipop or what?
Ice cream cone.
No, like a popcorn. Once you eat it, it dissolves in your mouth.
Cheese balls.
Cheese balls. Thank you very much. Once you eat it, it dissolves in your mouth, and then you keep pouring more in your mouth so that you can have a mouthful, but you never have a mouthful. So this thing dissolves like that and doesn't leave any remnants. It doesn't leave any stain on your clothes. It just goes out with the wastewater. That's how it is. I don't know where you can procure it in Lagos, but I believe that it can be imported. Most advanced countries, that is what they use. Most advanced countries, that is what they use. If we have people outside, we can ask them how they get it. And some of us that have contacts with people in CDC, we can ask them for contact on how to get some of these things. But it's not getting their contact, it's not having the money or the forex to buy them. So we should just make use of what we have now. Let's use our leak-proof leather to bag it, and then use our PPE while we are doing it. Instruct the laundry people to use their PPE when they are emptying it, so that as much as possible we prevent contact and transmission of organisms. Thank you.
Thank you very much, sir. God bless you. I know it can be sustainable. I'm quite sure
Yes,
of that. That cannot be sustainable. Even if
it's
we have
not.
it, it cannot be sustainable. So thank
It's
you.
not.
I'm just curious to know. I like to see it. I've not seen it before. Just to have a look on how it is. But I know definitely it cannot be sustained. But we'll get there in Nigeria. God will bless us. Thank you very
Amen.
much.
Thank you.
Thank you, Nurse Olas. Good to see you once more. So
Thank
it
you,
has been a
Doctor.
very interesting discussion. I think this will be is a good way to bring a cap to the end of our sessions.
Thank you,
This
Dr.
session,
Joan.
yes,
Dr. Joan, sorry,
yes,
do
I
we
can.
have access to the slide?
As long as you registered for as long
Yeah.
as you receive an email with the recordings. That's what we usually can promise, because not all presenters share their slides. For those that share slides, we share. For those
Okay.
that don't, at least we always get the recording of the
Of
session.
the
As long
Anyway,
as you logged in, yes, you receive
I know how to connect with Dr. Usman.
so why are you disturbing me now? Anyway, thank you. It's good to have
Thank
you in.
you.
Yeah, it's good to have you
Thank,
around. So as I
thank
was
you, man.
saying, uh, this collaboration began in September 3rd. That's first week of September, and we are having 2 sessions per month. So this session on linen management ends up being the last in this series. So this was the collaboration between APIN, NSIC, and Echo India, with ICANN in the background. And of course, we wouldn't have had the sessions without having our wonderful facilitators. And most of you will agree that we had top-notch sessions, and we were like top-notch sessions with a wealth of knowledge and information that was passed forward to be to see how we actually put what what we have learned into practice. Because IPC is what? Action. Is the action that makes the difference, is the action that brings down the numbers on healthcare associated infections. And this collaboration, I would like to know, I don't know if Dr. Abiodun is on the call. Is Dr. Abiodun with us, please? So he can share a few words before we round up.
He was on the
Amy, can you help me confirm if Dr. Abiodun is with
no,
us, or anybody from EPIN?
okay, he was on the call, but currently he's not on the call now
Oh,
yet.
okay. So APIN, so it was a collaboration with NSIC and APIN. We worked together to get the facilitators. They footed some of the bills, and then we provided the platform. So we hope we'll have another series, and of course, usually have a last Thursday echo sessions on NSIC. So at this point, I would like to say thank you to our wonderful admin who ensured that from the beginning to the end, the sessions kept going. To all those who, when they were called upon, agreed to facilitate and make presentations. Then to the wonderful participants who adhered to the rules as much as was possible and kept coming back session after session after session. And we hope that all this will help us to improve the standards of infection prevention and control implementation at all our facilities. So thank you once more, Dr. Olagoke. Thank you, all those who are present. Thank you, APIM. Thank you, NC. Thank you, IECO India. And thank you, ICANN. Hello, can you please mute?
Keep allowing her. She will
Hello, Amaka, I
Amaka,
don't know if you can see who is having a fracas there. Them. All right, thank you.
I muted it.
So
Sorry.
thank you, everyone. So we will be getting information on what the next steps will be. We would also like to follow up. We would also like to follow up with you and see how much of what you've been able to implement, also what's implementing, so that we can move on to the next step. Now, theory, practical, and implementation. So thank you, everyone.
Thank you.
Thank you, Bye for me.
Thank you.
Bye.
Thank you so much, Dr.
Okay,
Oga.
please.
Thank you, everyone.
Thank you all.
Okay, please hold on.
Thank you, Dr. Oga.
I want to mention that.
Okay,
Everyone.
Okay. I would like to mention that.
Yes, we can hear you, Amaka.
Okay, I want to mention that all the sections were recorded, even though that we do not have all the presentation slides, and they are available. So you could actually reach out to Dr. Abiodun. I'm sure he'll be able to provide the links to all the sections. I want to use this opportunity to thank everyone. Thank you, Dr. Lagoke. I really appreciate so much how you're able to, squeeze out the time to be with us today. And, it really helped us not to be able to move this section again. And I really appreciate that sacrifice that you've made today. Thank you so much, Dr. Juan. Thank you, everyone who has been on the call. And I would like to appeal with us to please turn on our camera before we go off so that I could take that photo again. I wasn't able to capture the screen for everyone.
Amaka, when we have come down to have. All right, no wahala. So cameras, and please say cheese. I'm about to say cheese. Maybe it's because we didn't say cheese the last time.
Yes.
The picture did not go
I want
through.
to see your beautiful face to face.
So say cheese, everybody.
I'm not.
Are you going to give me cheese?
A lot of people
These
on
are
the camera.
giving your children cheese balls. They are confessing. They come to today. I'm eating your children's cheese balls.
I'm still not able
It's
to.
camera. We said you should activate, so not audio.
Okay.
Yeah.
I'm still not